From Asheville, North Carolina, and I'm the biological mom to three boys, stepmom to one and guardian to another. That's all five of them over there. So the caregiver crisis has affected me in so many ways, probably every aspect of my life. I'll start with a short version of our story. My youngest son, Nicholas, who you can see there, was born prematurely at 25 weeks and 1 day. His primary diagnosis was BPD, or bronchopulmonary dysplasia, otherwise known as respiratory failure. And this led to many months of Nicholas, excuse me, fighting for his life in the NICU. A short period of time after we came home, after 10 months in the NICU, actually, we discovered that he had two cancerous tumors in his liver known as hepatoblastoma. So we went to Duke, where he had a left hepatectomy, which is the left half of his liver removed, and 3 rounds of chemotherapy. During the first 13 months of his life, I was forced to step away from my role as a medical coder, which led to our family actually facing homelessness and repossession of our family car and many other financial issues that came along with the decision that I made. And the reason why I stepped away from my job at this time was because of Nicholas's time in the hospital. I was getting called so frequently from his providers saying that he may not have much time left. So I need to really make the best use of this time with him. And so I did. And that's a little bit about what brought us to where we are today. And some of the things that I have experienced as a result of a nursing shortage are the first weekend that we were home from the hospital. I was told by hospital staff that I was going to have nursing care at home, 16 hours a day, and then 720 additional hours of respite care, which to this point, 5 years later, I've never tapped into those 720 hours. I don't know where they are. And the reason for that is because there is a shortage. There's never enough staff to cover those hours. During our first weekend home, I was alone with Nicholas. And that's him right there. If you can imagine the trach and the ventilator and all the things, the G tube, I was terrified, and I had other kids to take care of. And at that time, I didn't have my partner and no family to help me. Meanwhile, still with the knowing that I don't know how I'm going to make this work. I don't know how I'm going to pay the bills. And I honestly don't know how I'm going to be able to keep Nicholas alive by myself. I stayed awake for days on end during that time. I was afraid that he would stop breathing while I sleep, or maybe even drown on the condensation in his ventilator tubing, that he would need to be suctioned. He was on 15 medications around the clock. So he really did need 24-hour care like what he was receiving in the ICU. I just want to highlight the fact that I don't think it's safe for me as a caregiver and many others of us out there to be alone with our kids for days on end with nobody to call except for maybe 911 if an emergency happens. I was left to rely on my 4-year-old at the time to call 911 for me while I was resuscitating Nicholas because he stopped breathing after his trach came out. This has happened to many families that I know, where you're left in that spot where you need one hand to call the ambulance, but you need both of your hands to provide support to your kiddo. That's why we really do need an extra set of hands. And I've noticed and experienced that sometimes the nurses who are put into these roles are put there as an extra set of hands, but they don't necessarily have the training that they need to be successful in their role. Another time I thought if I left Nicholas with the nurse, I could go grocery shopping. So I went to Walmart. She actually called me and told me that his trach had plugged off and she needed to change it. So she took it out, put the new one in, and then decided the new one wasn't working. So she took it out too. This nurse, she panicked. She was a great nurse, but she didn't have the experience that she needed to be able to take care of him with a lack of support at home. There was nobody else she could call for backup. Needless to say, I beat the ambulance to my house and was able to, manage the situation. But I could have avoided a lot of consequences for him if I'd never left in the first place. And that's hard to know. I need to be able to grocery shop and, get food for my kids. So I think that having quality and well-trained nurses would really make a huge difference for us. That's just one example of some of the experiences that we've had. There's been a number of stories, and I don't have all day to tell you. I'd love to, but there's just so many. The nursing company has sent nurses to my house who aren't very well trained with the use of the ventilator or the trach, and I've personally trained greater than 50 nurses myself. All of about 6 of them have been quality nurses. They're willing to stick around for a substantial amount of time, which is about more than a few months. And I honestly don't feel like the amazing nurses that I've got the chance to spend time with are getting paid enough or have good enough benefits to keep them here. And I feel some sense of guilt about them being here, knowing that they might get paid less than what I would make if I was working. And I think that they deserve more than that. So I think if I were to propose a solution, I would really just like to see professionalization in the position of all direct support professionals and home health nurses, because they are lifesavers to us caregivers at home. They're the only way that we can pay our bills and keep our family going. And the last thing that I would really like to see is more support for the siblings of children and youth with special health care needs. Because if going to work to pay for the bills is hard, imagine going to a basketball game or a camping trip with a kid who's ventilator dependent. It's impossible. And these kids have experienced trauma with having to be the one to help me in the absence of another person. And that's all that I have time for today, but thank you guys for listening to my story.
Thank you so much, Brittany, for sharing that. Now I'd like to introduce you to Nancy.
Hello, my name is Nancy Gerardo, and I'm located in Greensboro. My caregiving story started with the birth of my children. Anthony is my oldest child. He was born in Columbia, South Carolina, 7 years ago, and diagnosed with autism spectrum disorder level 3 at age 2. Izzy is 4 years old. You can see her on the left-hand side. She is diagnosed with trisomy 18 or Edwards syndrome, which is a rare genetic condition that results in intensive healthcare needs and significant neurodevelopmental disabilities. Sadly, more than 80% of trisomy 18 babies born alive have congenital heart disease, which is the leading cause of death in this population. Izzy is a very special girl. She belongs to the 13% of children with trisomy 18 who have survived past their first birthday. As loving parents and caregivers for Izzy, we have learned to live one day at a time and cherish every single milestone that our tenacious girls accomplishes. We have also learned to advocate and bring our voice to the center of the table when systems are failing us. While in the NICU, following her birth, my husband Mike and I were very proactive and communicated to the team our desires favoring medical interventions and surgical procedures that could translate in better quality of life. Unfortunately, the medical team denied surgical interventions without taking into consideration our family values. Izzy needed a heart repair to survive. However, the team denied this life-saving surgery, stating that because of her diagnosis, it was too high of a risk, she was too fragile, and that the chances of surviving surgery were very low. Consequently, the medical team paired me in the NICU with another Hispanic mom whose baby also had a genetic condition and has decided to pursue comfort care. I was encouraged to spend time with her. I felt targeted as my husband was never paired with anyone, even though we both were in the NICU on a daily basis, and we also had made friends with other families. I felt that the healthcare system was feeling easy because the decisions of her care team were not taking into consideration our clearly stated wishes and family values. I also felt ignored and targeted for being a Hispanic woman. Advocating for our baby with a time-sensitive window for a heart repair was exhausting and at times really overwhelming. Those first days and months in the NICU, I had to divide myself between going to the NICU, caring for my newly diagnosed son with autism, and on top of that, juggling a very stressful and demanding job. During the first 3 months of her life, Izzy's congenital heart disease progressed to the point that she was intubated and placed on a ventilator. It was during this time that I was in the ER at least 2 times. In order to feel strong, I needed to have my family close to me. To make that happen, my husband Mike and I changed things. We relocated to a Ronald McDonald House near to the hospital where my daughter was inpatient. We also made changes to our jobs. With a change of scenery, our advocacy was fruitful. As a new team of doctors who listened to us and saw beyond her diagnosis, provided Izzy with a life-saving heart repair surgery that she needed at 6 months of age. Izzy spent her first night under our roof in January of 2020, just short of her second birthday. While she was greeted with 24/7 home health nursing initially, the advancement of the COVID-19 pandemic put an end to that, losing our entire team. Our family dynamics will have to change again as we will assume the care 24/7. Izzy has both cortical visual and severe hearing impairments. Therefore, our goal is that educators see Izzy in a holistic way, utilizing multisensory learning techniques that allows her to access her education and be as independent as she can be. Izzy continues to make progress in her developmental milestones, although at a much more slower rate than any typical children do. Izzy is a happy girl who loves smiling and physical embrace, especially hugs and kisses from her big bro. I believe healthcare and education policymakers should promote shared decision-making and enable processes that integrate the values and expertise of families and professionals. The importance of parents' voice in decision-making is sometimes diminished by providers when it comes to goals for care and education of children with profound medical complexities. And finally, I would like to see an integrated approach that supports interdisciplinary collaboration amongst providers and entities that provide services to a child with medical complexities or intellectual disabilities. And with this, I just want to thank you all so much for listening to my story.
Thank you so much, Nancy, for sharing that. Now I'd like to introduce you to Todd.
Well, everyone, thank you for having me today. Thank you for the ECAC for putting this on. It's really fantastic. You know, the timing of this is really interesting for me personally, because I've just been reading about the institutions and asylums that we used to do back in the 60s and 70s, and how this country went in through deinstitutionalized. It started in the 80s, and here we are in 2022. It really kind of brings together where the issues are, is that we now have all these cases at the home with the family, and have we really gone full circle to fully support the families? That's what we're kind of talking about today. It started with me with reading about the Rosenhan experiment and watching the movie One Flew Over the Cuckoo's Nest and doing a little research. So it's been really interesting. So the time of this has been quite interesting to me. Now on to my story. So my name is Todd Ringelstein. My son Clark is now 21 years old. He's our only child with my fantastic wife, Sandra. Our story is like this. He was born in the year 2000, and since the minute he was born, we've been playing catch up. Like, what is going on? Immediately he had feeding issues, problems controlling his temperature later on in early childhood. At first we saw his eyes weren't quite focusing, and it turned out it was his muscles, that the muscles entirely in his body were very weak. And what was causing all this stuff? And my doc was saying, well, it's time to go get an MRI. And I'm like, an MRI? Why do we have to do that? And it's like we've been playing catch up his whole life. Like, what in the world's going on? And it led to genetic testing to look at, is it genetic? Is it metabolic? What does metabolic even mean to us? All of a sudden, my wife and I are thrown in this world of, trying to become medical experts and trying to figure out which way to steer the ship from getting input from all these, well-qualified doctors. Clark's life's been in jeopardy 2 major times, which caused surgery. And every turn of the way, my wife, thank God, has made the right decision in trying to get all the expertise. So that's been extremely lucky for us. It's been, sorry, someone of course tries to call me during this. And it's funny when you go see medical professionals, because when they ask about how we're doing, how we're coping with the different medical issues that Clark has, and I even talk about the mental, you know, they always ask the mom. They always say it out loud, kind of a running joke in the family is, ask mom, she always knows. And I think that's super important to understand, all the medical professionals. What is the result of all this? Well, at the age of 20 or 19 or 20, we finally got a genetic diagnosis, which really didn't change our life a whole lot, but, you know, has a better understanding of how possibly, you know, we can help others moving forward and being part of a group. And also, Clark still continues to have a mental capacity of a 2 or 3 year old in some cases. He requires daily ambulation. He requires daily feeding, toileting, and bathing. So he's just someone that cannot be left alone. So for us, the caregiver issue is huge for us. We don't have family near us. So having a good caregiver nearby is just absolutely critical for us. You know, when they come to us, the training is severely lacking. We've had quite a bit of turnover through the years. And think about this for a minute. If you're going to go out and be a caregiver, you're not going to get paid all that great, although you don't have a lot of prerequisite training required. That's kind of good. But you're going into someone's home. And most times when we get someone trained up and we can trust them, you know, my wife and I go out and we do stuff because now we finally have respite. So now you're stuck in someone's home and their life and their family, and you're there with a nonverbal child who needs to be fed constantly and provided sips of water every couple minutes. Otherwise, you know, his health kind of goes downhill. So it's sort of a tall ask, if you will. I remember in the video, the father said, you know, when the child reaches, you know, puberty, that was a changer. It was for us too, because, you know, a lot of things change when, you know, when the child goes through puberty, because all of a sudden you do come up with the more aggressive responses. In our case, he had a lot of biting issues going on. So it is a challenge. It takes a special person to come into our home and to care for Clark, which has been great. We've been lucky. We've have currently and had some really good people to come help out, but because of the pay, the benefits, and what is asked of them, you can't expect them to fill in all the hours that we are allotted. We're allotted quite a few hours, and it's been years since we have fulfilled all of our hours on a regular basis. So it's been tough. I think, you know, we're lucky. I'm showing a t-shirt of a tie-dye t-shirt. Our current caregiver loves to bring in tie-dyes. You know, when we went down this road, we had never thought people would be coming into our home for their living. It's been a really interesting dynamic. We've made mistakes along the way. We've had to learn how to get used to people being in your house, but we need it. We need the help. We have to have a life outside of being a permanent caregiver. Now, I will tell you, Sandra takes on the majority of the brunt of the storm, I call it. I always tell people, if you were to call it a storm, Sandra takes the brunt of the storm. She had to quit her career. Sounds familiar, right? And she's a full-time caregiver, and it weighs on her constantly. My job is to go out and provide a living to provide for my family. So that's just kind of the way things shook out for us. One of the biggest issues we have is with the agencies. I'll be flat out honest. We've been through a couple of them, and their MO is to fill the square and to get people in there. And are they really to blame? How much have they been set up for success? So we really need to ask ourselves that question. You know, the agencies, they get people in with minimum qualifications. I really think to legitimize the business would be the way to go. I think, you know, so a couple of things that have happened on a positive note is that our caregiver has been got our house certified for respite care. That's been huge for us. Just getting the child out. We can have some respite time ourselves, even if it's for a partial of a day. It's just huge. I think that was a great thing. Day programs like Ryan's Bridge here in North Carolina, it's awesome. A place for folks to go to have out in the day. And I think that's really a great direction to go as well. Anytime you can get special needs people out in the community, it's just awesome. And I'll leave you with this. Hearing some of the other parents in the video, people come up to us all the time and they say, you know, Clark is truly, you must be blessed to have Clark in your life. You're lucky that Clark is lucky to be in your family, or God put Clark in your hands for a reason. It's always hard for me how to react to all that. You know, it's just, we never set out having a child being put in a situation, but here we are, right? And we deal with it the best we can. Having better, stronger caregivers would be absolutely huge for us. And I went over my time a little bit, but I hope that helps.
Well, thank you, Todd. We appreciate you sharing that. And yes, we are all doing the very best we can. Thank you very much for sharing that.
Welcome.
Now I would like to introduce you to Anastasia.
Hi, everybody. So my name is Anastasia. I'm going to tell you a little bit about our story and then how the shortage has affected us. This is my little boy, Alexander. He is almost 2, and he was born in December of 2020 with what we thought was just then a congenital diaphragmatic hernia. So all of his abdominal organs were in his chest. It affected his lung growth. And similar to other parents, I had been prepared for his death. They had told me the whole time that he wasn't going to survive. And there's a lot of grieving that goes in that. And we found a doctor that was willing to try and give him a chance in Florida. So we went at about 6 weeks old. Well, let me back up. At less than 23 minutes old, Alexander was put on ECMO, which is the most severe form of life form. It circulates all the blood through your body, and it performs the work of both your heart and your lungs. Within the first 12 hours of his birth, he had major surgery to repair that hernia and to move his organs. And at that time, we didn't know he had a brain condition. His brain, we went to 3 separate MFM specialists who said his brain was fine. His brain was good. And so we just thought, okay, he's got small lungs, but there's this chance. This doctor in Florida gives him an 80% chance. And if I can just get over this hurdle, he'll be okay. Well, at 6 weeks old, we found out he has a condition called holoprosencephaly. And if you look up holoprosencephaly, it means that the brain did not divide in half properly. And there are 3 different variations, but the numbers are very bleak. Less than 3% of these babies make it to birth. Less than 1% make it to 6 months. And when you reach those kinds of numbers, when you see those kinds of numbers, a lot of times you have to start fighting for any type of intervention. We were very lucky in Florida to be with doctors who valued my wishes and my family's wishes, because he needed a heart surgery too. And they never told me no. They never tried to make that difficult. But then this year, we were at a different hospital and he had a bowel obstruction. Bowel obstructions are very common in kids who have had abdominal surgeries. And for kids who can walk and talk, it's not hard for them to get a surgery to repair a bowel obstruction. But for me, I had to wait for 7 days for them to be willing to do this surgery. And then they saw the chance that he might have reherniated. And they asked me, well, where do you see him in 5 years? Where do you see him in this amount of time? And I told them, I said, you know, we've always been taught to take everything a day at a time, just one day. And she said, well, you're not in the NICU anymore. You need to start looking at the long-term picture, because they don't value his life. And because they don't value his life, those surgeries that would improve his quality of life, they don't want to perform them because they're more difficult on a medical complex kid, and they're more time consuming, and they don't react the way normal kids react to medications and to other things. And it was really, really difficult to have to fight for a procedure that actually is 90% of what pediatric surgeons do, is bowel obstruction surgeries. And it was really heartbreaking to think that they got to make that decision. And so they did do the surgery and he's fine and we're home now, but it has really changed my ability to trust caregivers. And now I'm in a very different place than I was 8 months ago. 8 months ago, I was working, I was teaching, I taught special education. And with all his appointments, with the nurse call outs, with the inability to find nursing, I was missing so much work that I couldn't stay on top of the workload. And my boss gave me an ultimatum. She told me to leave my child in the car, to leave all thoughts about him in the car when I got to work. And at work, I needed to focus on the kids there. And I don't have the kind of kids you can do that with. There were times last year while I was at school where he had an inexperienced nurse because they hired a brand new nurse from that had never worked anywhere. She didn't have enough training, and she caused him to decannulate because his suction cord got stuck in a toy, and she didn't notice, and she didn't know how to put it back in. She didn't know how to bag him. And while his dad and I are no longer together, if he had not been there, my child would have died that day because that nurse did not know how to provide the life-saving care. And so nursing agencies, they don't have enough staff to staff all their kids. And so one of the things they're doing is they're going to nursing schools and they're staffing brand new nurses that don't have any experience. And 3 times this has almost led to Alexander's death. And every time that happens, it gets harder and harder for me to be willing to leave him with nursing staff. They're supposed to be there to be a relief so that you can rest, so I can go grocery shopping. But I'm terrified because some of them are not trained well enough to watch them, and they're not paid well enough. So some of them sit on their phone. We've interviewed nurses who saw that I had a baby monitor. Now, the baby monitor is not to watch them. It's to make sure that he's safe so that everybody in my household can hear him. But she didn't want to work where there was a camera. I, on a separate event, checked a camera to see if I could see a decannulation event and caught a nurse yelling at my less than 2-year-old. He was 1 year and 1 month old. What could he possibly be doing to be yelled at about? He doesn't play independently. He has cerebral palsy. No need to yell at him. He's a baby. In addition, you find nursing agencies are struggling to staff these more complex kids. Yesterday, I read on a forum that a nursing company discharged a family because nurses are no longer taking these more complex kids. They're not paid enough. They don't have the resources. And that's scary, and on top of that, similar to many other families, like I need to go to the doctor. I need to be able to go to the store. I am having my own health issues and I cannot get there to the doctor because I don't have anybody to watch him. My family loves my son, but they will not watch him because they do not feel safe. And even though they've been trained in emergency management, they will not watch him. And we have to find ways to counteract this because parents are people too. And sometimes we do have to go to the doctor or go somewhere without him. Right now it's virus season. I shouldn't be taking him anywhere. He has 1 functioning lung, but sometimes I don't have a choice. Thank you.
Thank you, Anastasia. Finally, I'd like to introduce you to Ebony.
Thank you, Christy. I also want to thank everyone for being a part of this panel and discussion today. My name is Ebony. I am from the Triad region of North Carolina, really excited for this opportunity to view this video and to be a part of this amazing panel with Anastasia and Todd and Nancy and Brittany. Really, really excited. So my family, I want to talk about my family. So my daughter, Lila, was born with a rare genetic condition. We were told that there's less than 20 people that have her condition in the whole wide world. And we found that to be true when we went to look for resources and other things. She has a rare form of dwarfism. She has a cerebral palsy, seizure disorder, a number of other things that are going on with her as well. She's very little, proportionately so, but very little. So she is 14 years old and she is 30 pounds. So that kind of gives you an idea of how small she is. Very medically complex. And because it is a rare genetic condition, there's so much that's unknown about her. But what we do know is that she is alive and that she is here. So as other families have shared, already. She is alive. So we were told that she would only be alive for a few years, maybe 2 years, but God has blessed us with 14 years of life, soon to be 15 years of life with her, and we are forever grateful. I also want to say that I have an 8-year-old son, and he has brought more life to her than any medical provider or therapist could have ever done. He keeps us busy, but he also motivates her. He causes her to look around and smile and stimulates her in many different ways. My husband and myself are tag teaming every day to take care of our family however we need to. And we are doing that together. What I want to just talk about just in my time is just really the toll that having a special needs child takes on caregivers, right? And so we know that the needs are great for the child in terms of their health needs or even their mental health needs. But for caregivers, the needs also continue to be great as well, whether we are dealing with physical issues or even just chronic stress, which was talked about in the video. And you know, this is my second time seeing this video, and so many things come up for me as I watch, and I'm bursting with excitement for what we could do in North Carolina as it relates to moving the dial a little bit, thinking about caregivers, maybe even setting the tone or the pace for how things could be across the country as we think about what we can do here in North Carolina. But for caregivers, we are constantly on guard, you know, thinking about our own ability to rest or to sleep and what that looks like and how that's impacted when you have a kid that you have to listen out for or look at or watch monitors, constantly on guard. Physically, there's no time for yourself, right? And so either you are taking care of your child or you're trying to do something for yourself or you're doing something for your family as a whole. And so one of the things that you know, I thought about as I was invited and had this opportunity to speak with you all today is really to think about many different things, but really thinking about that family as a whole, right? So if you are a caregiver and you've been taking care of a child, whether it's a new baby or a toddler or a young child or even an adolescent or young adult, you start to learn the ropes. You start to know the answers to the questions that you need to answer. How are things going? What are the appointments looking like? Do you need anything? Do you have all your supplies? And we're checking those boxes and we're answering those questions, but there's some questions that are not being asked. And then if they are being asked, maybe they are not being asked in a way that caregivers feel like they have a place to share. And so one thing I would encourage or I would like to see or something that can come out of this as we think about caregivers being seen is for providers really to take the time to ask the questions and look at the family as a whole. As I stated earlier, as I introduced my family, you know, my daughter has a sibling, an 8-year-old sibling. And, you know, it's very important that there are resources and supports out there for him. I have a very a clear example of why this is super important. We know that COVID exasperated many things for many people. We did virtual school. We continue to do virtual school for my daughter, but my son is actually in school every day. And during the open house for his 3rd grade class, some of the kids were going in and hugging the teachers and talking to the teachers. And I noticed that my son did not do that. And so when we got home or we made it back home, I said, hey, buddy, I just noticed, you know, your friends were coming in and kind of greeting your teacher and hugging. And, you know, I noticed that you didn't hug her. Tell me more about that or what's up with that. And he said, Mom, COVID. I don't want to hug people. I don't want to get Lila sick. And I started to think about the toll that not just COVID, but being a sibling of a child that has a lot of complexities and medical needs, what that has done or the toll that is taken on him. And I can't help but think about how important it is to have resources and supports for siblings, but also for families as a whole, as you guys look at us as a whole family unit, as a whole family system. And so as I think about proposed solutions or ideas, I think about making sure that the right questions are being asked. I think about making sure that you're looking at families as a whole. I think about trying to figure out how to bolster and improve informal support systems, right? So things that can be done for families. My support system, I have awesome neighbors and friends. As many others stated, I don't have family close by. And so I rely a lot on my neighbors and my friends and my people right here in my circle. And so just thinking about a family as a whole unit is going to continue to be important to help to move the dial as we think about ways to take care of caregivers who are out here. Thank you.
Thank you all so much, Brittany, Nancy, Todd, Anastasia, and Ebony, for sharing your beautiful families with us and your impactful stories. We really, truly appreciate it. Your voices were heard and we see you. Now I'd like to introduce you to 4 professionals who work in different capacities to serve families and children with special healthcare needs and disabilities. We've asked our professional panelists to share their experiences and their professional roles related to this issue, including challenges and ideas for solutions. Today, we're going to hear from Dr. Savithri Nageswaran with Brenner Children's Hospital, Dr. Ashley Chadha with Levine Children's Hospital, Tally Wells from the North Carolina Council on Developmental Disabilities, and Kaylin Zabransky with NC Child. First, I would like to introduce you to Dr. Nageswaran.
Thank you, Christy. And thank you for all the parents for sharing your story. That was incredibly powerful. I probably will reiterate most of what has been said, but from a provider perspective. My name is Savi Nageswaran. I'm a pediatric palliative care, complex care physician at Brenner Children's Hospital in Winston-Salem. I've taken care of medically fragile children for nearly 15 years now and have knowledge about parents and caregivers' experiences, but also hear regularly from my teammates who work very closely with caregivers of these children. And also over the past 10 or 15 years, I've learned about caregivers' experiences through the research that we are doing. So that's the perspective I'm going to bring today. We know that medical technology has helped immensely for children to survive complex health conditions, and it's a blessing, and parents perceive that as a blessing, and they're thankful that that has allowed children to be at home. Parents love taking their children home and take good care of them at home. But what has happened is the way our system is designed over the past several decades, the responsibility of providing really complex medical care for these children at home has shifted to families. And that's where the problem is. It's very difficult to provide the medical care these children need, and including handling these complex technologies. Brittany, Anastasia, they all talked about it eloquently today. In our children's hospital, some of these children have, when they come in the hospital, they have to be either in the intensive care setting or one step lower. They cannot even be in a regular pediatric floor. But when they go home, irrespective of the resources that these caregivers have, they are expected to learn and provide the same level of care that medical professionals provide in a children's hospital. They have to manage technology, they have to problem solve clinical issues, they have to decide when to take their child to the hospital and ER. And believe me, they do that a lot. And so parents, in addition to being parents, they have to transform into doctors, nurses, respiratory therapists, care managers, pharmacists, on and on and on. And so that's a very difficult situation to be in. Just think for that for a moment. And Brittany mentioned that so eloquently, how hard it is to provide that medical care at home. And parents have to do that when they are so emotionally connected to the child, and having to do that in addition to not knowing what's going to happen to their child, and also not knowing what's the consequence of that medical care for their child. So that's a very tough place to be in. Many talked about the stress of caregiving, including the documentary. I personally know some caregivers have not gotten a good night's sleep for 10 or so years continuously because they are providing round-the-clock care to these children, and they don't have any supports, either formal support or informal support. I think Anastasia mentioned that There is no formal support. Grandparents or others can provide some support, but to provide that level of care for these children is just beyond the capacity of many informal caregivers as well. So that becomes a problem. So caregiving, this level of caregiving is disruptive to all aspects of families functioning in many different ways. And when you talked about it today, caregivers are not able to keep their job or find job. They're not able to go on a vacation. It disrupts siblings' lives pretty significantly. We've seen families that have broken up just because of the difficulty of providing this level of care. So when this is difficult for caregivers, this is substantially harder for those who are poor, who have very limited resources, who are not English speaking, or who face prejudices already, or have health problems themselves. So I cannot even imagine all the complexities that go on in addition to the caregiving for some of these families. So another population is some of the families that we have are caregivers themselves they've had their children when they are teens. And so they face very special problems. Imagine a 16, 17-year-old spending about 10, 15 years of their life providing medical care for their child, and their life trajectory changes completely at that point. But we don't have enough supports for these families there. So now in our hospital, we have some children for many months and some several years, only because they don't have enough supports in the community for these families to be able to take care of them. And that's actually a shame, and it's a problem with the system that we have. So clearly our system is not working well, and that's because it was designed many years ago for acute care. And if you're sick and you go get acute care, you're fine. But for chronic conditions and that involve multiple specialists and providers and this level of care at home long term, our system is not well designed. Many spoke about home health nursing crisis. That's a big problem now for us. We have systems such as the Medicaid transportation, for example, that make it very difficult for families to navigate. They need all of this, but it's really difficult to navigate that system. And I would say that all of these have gotten 100 times worse with COVID. Nursing shortage has worsened. All the families' ability to navigate the system has worsened. So it's a real challenge now that we have. So what do we do? I think the responsibility to take care for these children does not rest with families alone. We as a society have a responsibility to take care of these children and their families. I must say that we as providers, program leaders, and policymakers, we know very little about the extent of the stress and difficulties these families face. I myself recently was listening to interviews of parents, part of a research, and I was blown away. And by the level of difficulties families face, just bringing children to in-person appointments, and that brought me to tears. It was just, so I myself, having done this for 15 years, still don't fully understand the extent of difficulties families face. So maybe as a provider, I can be more graceful when a child or a family doesn't show up for an appointment. Also, we need to start thinking about how to redesign our system to support children and families. We desperately need respite care. You mentioned that. We need other alternate options. So we should think about long-term care facilities as an alternative sometimes. We need to advocate for systems and policies that actually work for families. And again, we should advocate for funding to support families. So I'm so thankful that ECAC has arranged this, and we've gathered here to bring attention to this very important issue.
Thank you so much,
Christy.
Thank you. Thank you for sharing that. Now I'd like to introduce you to Dr. Chadha.
Hello, good afternoon. Thank you so much for allowing me to be a part of this webinar and this viewing. I share in comments that were made previously, but particularly want to just thank the families for sharing their story. It's funny, a couple of you actually my patients, and I still don't have the full window into what your day-to-day looks like. And similar to what Dr. Nagaswaran has said, over the last 10 years or so of my career, although my medical career has gravitated towards this patient population, my overall knowledge and comfort and understanding on how best to advocate is still very young and still growing by leaps and bounds every day, and growing today even. I think one of the things that I wanted to highlight is the complexity that we see from a medical team in the acute care and the acute decisions we're asking families to make. I think one of the things that I've struggled with probably the most over the last several years is the realization that we were making acute care medical decisions and medical recommendations to families. And I don't think we've done a good job historically of truly obtaining informed consent of what that means for the family. What I mean by that is we focus so much on the acute intervention. For example, placement of a tracheostomy tube. We want to educate you on the surgical intervention of a tracheostomy tube, but do we really truly prepare our families for the years, the months, the weeks afterwards, what that looks like? And now, in the absence of effective and truly educated care in the home, what are we really setting these families up for? And so each day when I'm at the bedside, I'm having those conversations with families. What that really must do for us in the healthcare profession is we have to go beyond our walls. We have to advocate so we can close that gap. We're making the best medical decision at that moment. We're supporting the family. We're trying to really integrate the family's wishes into that decision. But once we leave the hospital, we have to make sure that we're advocating outside of those walls for the chronic care that Savi talked about. And that's really, I think, the biggest gap that we're seeing in our society right now. Todd mentioned the movement from institutions and institutes into the home. Well, with that came a real lack of funding for the infrastructure that's required, and the reality that it's not a one solution phenomenon. For some families, institutions may be helpful. For some families, nursing in the home may be helpful. For some families, respite may be helpful. We have to make sure that we're looking at this at all the different angles that it requires. And that can feel very overwhelming. Very, very overwhelming for a family, for a physician, for others to say, how do we find that solution? And I think as we prepared for this documentary, what I really wanted to encourage all of us, there's 328 participants, right? That's the number that I see at the bottom of my screen, 328 participants. That's a very strong voice. One of the biggest issues in children with medical complexity is that it has so many different diagnoses that we as a medical team lack collective data on its impact to our society. What I can tell you is that it is a very large number with a very large impact, and some of the work that Savi and others are doing to capture that allows us to advocate in a profound way. So even though it is very hard to understand the next step, it's very hard to understand the solution and to get to that point, if each day we just do our very best to advocate, to draw attention to the problem and to advocate for the best solution in that environment that we have, making that best decision, we can really impact a large outcome. If each one of us, all 328 of us, talk to our representatives, talk to the physicians, talk to our healthcare system that we engage with, and advocate, whether it's through a family advisory board, whether it's through just a one-on-one conversation in the hospital with administration, whether it's a phone letter, a phone call, a letter, or an email to your congressman, we can start having a collective voice that's very strong. We can start speaking at a higher level and a higher volume. And we won't only be unseen anymore, we'll no longer hopefully be unheard. I think that's what we have to do. We have to encourage each other to do that. And we have to support each other in that endeavor. And we have to collect data to support that. Savi's doing amazing work. She literally emailed me this morning about more work she wants to do, another grant she wants to write. And so I think that we need to continue to do that collectively. We need to also continue to listen. Like I said, we don't necessarily have all the solutions, but we need to use our positions to advocate for these families. I really appreciate the time today. I really appreciate the opportunity to be a part of this. I don't pretend to have solutions, but I promise you I'll be a part of the fight. And I think we all can just do our little part in our neck of the woods, so to speak. It can be very powerful collectively.
Thank you so much, Dr. Chadha. Now I'd like to introduce you to Tally Wells.
Hi, everyone. I'm Tally Wells. I'm the Executive Director of the North Carolina Council on Developmental Disabilities. And at the Council, our work is to do the advocacy that Dr. Chadha is talking about, because we are federally funded to advocate for systems change, system improvement for people with intellectual and developmental disabilities and their families. And we have to change the system. The system is broken right now. We are putting too much on people with intellectual and developmental disabilities and their family members. And it goes not only from childhood, which this film is about, but all the way through adulthood. And then what happens when that primary caregiver, the family member, dies? That's what we're experiencing right now at the council. Our council chair, Brian Dooley, who has been amazing at sharing his story. His mom died of cancer last year. He is 32 years old, has a very significant disability through cerebral palsy that causes him to need supports with most of those activities of daily living. And so whether it's just eating, getting in and out of his chair, and all sorts of activities. And because of the workforce shortage right now, he doesn't have the direct support professionals he needs. He has as his only backup really his 85-year-old grandparent, 85 and 88-year-old grandparents. We have just actually yesterday sent a letter to the governor to ask for a meeting based on something I'll talk about at the end of today, which is a court decision called Samantha R. that's just come out, the upcoming legislative session, and the twin crises we have. So we have two major crises, and we've had a lot of debate about whether to even use the word crisis, because crisis is like a hurricane that seems to come and go. This is something that's been building over time and is only going to stay with us and become bigger if we don't take this on. And if we don't do what Dr. Chadha said, which is each and every one of us, and I know I'm talking to an exhausted group that has no time in your day to do this, but I'm pleading with you to actually make sure that you know your representative, that you know your state senator, and that they know your story, and that they know what's happening when you leave Dr. Chadha, when you leave Dr. Nagaswaran, and you go into the community. What is happening? How much is put on you? And we are going to continue to support that at the council for you to have those connections. We're going to continue to speak your voice. In fact, we had a news story on CBS 17 just this week about the two twin crises. So what are those twin crises that I'm not supposed to call crisis? One is the workforce shortage that we've been talking about all day. But the second is the number of people who are on the waiting list for services. We don't have enough services through what's called a Medicaid waiver. And that's particularly important once you have aged out of children's Medicaid and are going into adulthood. If you don't have that Medicaid waiver package of services, then there's a lot of services that are harder to get. The good news is there's a new service coming online. It's called 1959. It's starting December 1st. I'm excited about it. I don't have time to talk about it, but you should be talking to your LME-MCO, which I'll talk about in a minute, to try to get those services. But the twin crises are the unmet needs because people are on the waiting list, and the unmet needs because of the workforce shortage. And what we're doing at the North Carolina Council on Developmental Disabilities is we have a monthly policy education committee meeting where we bring policy leaders to specifically discuss these issues. We're in the process of finalizing a film on the unmet needs of both these twin crises. We were on CBS 17 this week, and we can share that link. We will be continuing to do leadership trainings that you can be part of to gain some expertise, but you don't need a leadership training. You just need a phone and an opportunity to talk to your representative and senator and make sure they They know your stories. We've even got a singer-songwriter, and he's wrote an amazing song. He opened for Amy Grant and for Daughtry and other folks. He's written a song about the waiting list and about the workforce shortage. We are trying to raise awareness in all the ways we can, because as we get ready for this legislative session, we have got to invest in our workforce. We have got to invest in these Medicaid services. We've also partnered with the providers. We really, right now, we're paying $12 or $13 an hour for most of our direct support professionals, most of the folks who provide that sort of baseline caregiving that we so desperately need. We need to get that up to at least $18 an hour. So we have a rate study right now to be able to show folks at the General Assembly and in the governor's office, what is the actual cost to get that up there? And the good news is that 2/3 of that cost can be paid by the federal government through Medicaid, and the other third would be paid by the state through Medicaid. But it is a significant investment that we just have to make. So I'm going to get a chance to share a few more resources in a minute, but with that, I'll turn it back to Christy.
Thank you. Thank you very much, Tally. All right, and finally, I would like to introduce you to Kaylin Zafransky.
Hello, everyone. I'm Kaylin Safransky. I am the Health Policy Director with NC Child. We are a statewide policy organization that works to improve the lives of children and family, regardless of race, ethnicity, or place of birth. And I'm just so honored to be here and to sit amongst the incredible stories and efforts that not only were shared with us, but I know are a part of the over 300 people that are sitting on this webinar with us today. So we've heard a lot about, we've heard a lot about, what is experienced and a little bit of what we need and what we can do about it. I want to name a couple of things. From the policy perspective, those are the waters I swim in, especially on the Medicaid policy side. It is, never a quick fix, annoyingly so. I know that as somebody who has been a caregiver before. I know that as a human being who needs healthcare just like everyone else. And so when I think about policy, I want us, especially for folks here today, to think about our opportunities for what we really need, which are our menu of options. What we have heard today and what has been displayed in this documentary is that there's never going to be a one size fits all, because our children and our families are not cookie cutters. We are not boxes to be checked. And so I think there often becomes a disconnect there when we think about policy advocacy. And so we have to work on a robust constellation of some of our needs that need to be addressed. And we also, I think, have to have kind of clear eyes as we move forward, because we do live in reality, for better or for worse sometimes. And the reality is change comes slow, even when we needed it 30 years ago, even when we've always needed it. So I would be remiss to say that one of the key priorities that NC Child has been working on in this space is Medicaid expansion. We need care for our caregivers. We know that so many of our caregivers don't have access to healthcare. They do not make enough money because of their needs at home to be able to purchase and afford care from the marketplace, even with subsidies and supports. We need Medicaid to be expanded so that we have access to services that everybody in the entire family unit requires. I'm so grateful, Ebony, that you brought that up, that entire family perspective, because that leads me to some of the other things that we're working on. We need to provide not only our physical health care, but our mental health care, and it needs to happen where we are. It needs to come into our homes. It needs to be in our schools. It needs to be in our community centers. I don't care where we put it, but we need to put it where people are at, so we're not adding more burdens. So we're working on creating more opportunities for our students in schools. And of course, for our children who are able to go into schools for education and have that little bit of respite for families and experience for them, we want to make sure they have access to all of the resources that they need. Medicaid can be quite robust in the school system, but we need the state to be on board with that. We know that there's a workforce shortage that I don't think is surprising to anybody here. We have had one long before COVID. COVID exacerbated it, but it's always been here. I was at a meeting earlier this week with the North Carolina Institute of Medicine, and we were talking about the workforce issues and how complex they are to fix. But one of the things that became very clear was it's on us. It's on us as advocates to help people think through the solutions. Rates absolutely need to change. We need to pay people more so they're incentivized to be in these positions, especially for our private duty nurses, especially for our in-home care workers. And we have 5 medical schools in the state and countless other medical training opportunities through our community colleges and other universities. Yet we have almost no incentives to keep people who we are training here back in our state. They are getting trained, they are getting their degrees, and they are leaving for other states. And so it is an opportunity for us to work with the elected officials that Tally was just naming that are so important in this, and help to share those stories of why we need to start thinking more creatively about getting folks to stay in our state and provide this care. We cannot be a hub that trains people and ships them across the country. We just can't do it anymore. And that's what we've been doing. And then we need to really help, and this is a harder one because it involves the federal government, which always mucks up the business, but we need to make sure that we have supports in place for things like paid family leave and paid sick leave, and that we are expanding our definitions for what that leave includes, so that when we have a need at home to take care of our child with special healthcare needs and our medically complex children and family members, that is a qualifying condition for us to be able to leverage those hours off without losing what allows us to put food on the table and a roof over our heads. And then the other one, I think that I would want to name too, and I know this is a lot, and just know that like we're thinking about this at NC Child, our partners are thinking about this. We've been working on so many of these issues, but we have a lot of services and supports that already exist, at least on paper in this state, especially under Medicaid. And we know that on top of being provider shortages and everything else, we have staffing shortages at our DSS offices and at our Medicaid department, DHHS. But to really help them prioritize through sharing our stories and through pushing on them and putting pressure and really advocating things like more supportive non-emergency medical transportation, so that we can actually get to our appointments. We're not waiting hours. That is inhumane to make people wait for hours and hours in a waiting room or sitting at home to wait and not know when they're getting picked up. We need to make sure that we have really integrated care. Right now, our system is separated between our mental health, our physical health and behavioral health, and our oral and vision healthcare. All 3 disconnected. We've got to bring that body back together. We've got to be integrated so that care management can mean something to families. So it's actually helpful and supportive, and so that you don't have to think about, okay, my kid needs this, and then I've got to call these 10 people to try and get the referral to make that happen. These are all things that the state can absolutely do. We just need to really help push that forward in the noise of everything else that needs to get done, right? We're always competing a little bit against ourselves. But just again, wanted to be so thankful for having this opportunity to talk to y'all. I will share on this slide. That is my contact information. Feel free to reach out. If I don't know the answer, if I can't help you, I will certainly do everything I can in my power to get you to the right person. On our website, you can learn how to take action on all of our issues and campaigns. They're listed there, including our work that I just named. We have a child advocacy network that you can join and stay connected and get training on becoming an advocate, on how to talk to folks at the General Assembly, talk to folks at state departments. And then we also have incredible opportunities through our Parent Advisory Council and other efforts that connect us back to the community, because the community is who we represent. And so we want to lift your voices and share your stories, of course, with your consent, but really make sure that you are at the decision-making table. It's not us, it's y'all. The people that are closest to the issue get to make the solutions. So thank you so much.
Great. Thank you so much, Kaylin. And thank you so much to all 9 of our panelists, just a bunch of amazing people, just with amazing perspectives. And we are so grateful that, when we approached you, and said, hey, we want to do this thing. And all of you were just like, yes, we want to do this thing too. So it is going to take all of us together, and just thank you so much for your participation. So now what? Many of us in this room already know about these challenges. So we want to take a quick minute. Kaylin just shared hers, and share a couple of other ways that everyone can get involved to help improve the systems that serve families of children and youth with special health care needs and disabilities.
This is Tally. So if one of the great ways that you can stay up to date on everything is if you join our newsletter, and you just sign up at our website, and we're nccdd.org. We're your Council on Developmental Disabilities. We're made up of 60% people with intellectual and developmental disabilities and family members. And then the rest of our leadership are state agency leaders at DHHS, Department of Public Instruction, and Department of Public Safety, as well as we have 3 legislators on our council. We have a monthly newsletter, and we put all of the sort of the main policy updates there. You're welcome also to go to our calendar on our website, and we keep up to date as much as we can. Encourage us around developmental disability, sort of a solid B on getting things up on the calendar. So we're really working to get up to that A to make sure we've got everything on our calendar. But we want to make sure that we're sharing as much about what's happening. We have funded a new initiative called Meet the Need NC, which is specifically focused on meeting the need by ensuring that we're raising rates for our workforce and having a solid workforce, particularly direct support professionals, and also meeting the needs of folks who are on the waiting list for services, developmental disabilities. And they have a new website, Meet the Need NC. You can just Google it. They're going to be having monthly community engagement events and policy update events all throughout the coming year in 2023. So they're finalizing that schedule, and you can go to their website for that information. Disability Rights North Carolina is your protection advocacy organization that advocates for people with intellectual and developmental disabilities, mental health disabilities, physical disabilities, traumatic brain injury. I'm going to talk a little bit about a very recent lawsuit where they've gotten a very strong court order, and a town hall that's going to be tomorrow. Department of Health and Human Services, that's your North Carolina agency that is in charge of all things health and human services, including Medicaid. And they do a very good job of keeping their website up to date on all things health related. But the place that you go if you need services to start out is your local, and you need state funded services or Medicaid services for your child or adult with developmental disabilities or yourself, is your local management entity, managed care organization. And it is a ridiculous name, LME MCO, but it's basically just your regional organization. I've got a link on this PowerPoint that you can click on, but you can just Google LME MCO directory and you can find your local one. And that's the first place you should call to get supports and services. And as I say, there's a new service that's going to make it much more, Medicaid services much more available to people with developmental disabilities on the waiting list. You also, if you're not familiar with the waiting list, that's something you really need to research. It's called the Innovations Waiver, and it's a service, a package of services through Medicaid for people with intellectual and developmental disabilities. And it has right now over a 10-year waiting list on average for people. So you need to get on it as soon as possible, or have your loved one get on it as soon as possible. And if we could go to the next slide. Tomorrow, there's going to be 2 town halls about the court decision that I mentioned. The name of the case is Samantha R. That's Samantha R's picture. And Samantha was in an institution and was fully capable of living a full and meaningful life in the community. And a lawsuit was brought on her behalf, on behalf of all people with intellectual and developmental disabilities. There was a court case on court decision on November 2nd, stating that the state needed to make sure to serve all people on the waiting list within 10 years and to ensure that we have a full supports for direct support professionals, that we have enough of a workforce, as well as to transition up to 3,000 people from state institutions back into the community. There's discussion about what will happen sort of next with that case. So I encourage you to sort of follow the news and see what happens next. But tomorrow there's going to be a town hall at 12 and a separate one at 4 p.m. And if you go to the Disability Rights North Carolina website, you can find out more information about that town hall. Thank you.
Thank you, Tally. Hi, folks. My name is Amy Combs, and I am the Assistant Director of Programs here at ECAC. And I know that we are running into a little bit of overtime, and so I will keep this short. I just wanted to make folks aware that we will be emailing out a bunch of follow-up materials. And so what we did is we gathered together a variety of resources for caregivers and also the professionals who serve them, just to kind of tell about some opportunities out there for advocacy, for leadership, some upcoming events, and also a lot of tools and resources that families can use in their individual advocacy, but also possibly at the local, state, and national level. We did paste a survey evaluation link in the chat box. If you can, go ahead and take that survey now. If not, we will also include that in the follow-up email. I know there was a lot of questions in the chat about being able to watch this again. The producers have given us a link that we can share with those that registered. So it's really not to be shared out with others, only those that registered for this event. They don't have to have attended it, but they do need to have registered. And so we will include that in the follow-up email as well. And we will hopefully get that out sometime within the next couple of hours. But the resources that we pulled together, some of these are state level and some of these are national level. And of course, we'll include information about the North Carolina General Assembly. These are our lawmakers. These are the folks that can really bring about some of the changes and ideas and solutions that folks have brought to the table today. I did want to go ahead and again, thank you to the North Carolina Council on Developmental Disabilities, again, for making funding for this event possible. Airing this documentary came with a pretty big price. Most folks are doing it at a cost, charging $10 a ticket. The council provided us funding to make this available to all North Carolina families and professionals for free, and so we appreciate that. We will include information about the caregiver.com documentary and their website. They've got a cool toolkit on there as well. And they are also still recruiting families to share like 1-minute video clips of their story to use as bonus content. If you need more information about ECAC, this is where you can find us. We are in a lot of spaces and places, and so we encourage you to follow us on social media, sign up for a newsletter, or reach out to us if you want more information about the free services that we provide to families in all 100 North Carolina counties. I think that I may have covered everything. Christy, pop on if there's something that I am forgetting. But I do appreciate those that hung out for the extra time. We still got 261 folks that came into overtime with us. And so we appreciate that. And of course, a huge thank you to our panelists. I got to tell you, there was a minute there I really had to get myself together, not only watching the documentary, but hearing some of the personal stories, because I personally was overwhelmed by the amount of love that you all have for your families and sharing your beautiful families with us and just knowing how hard you work and all that you do. And so thank you to our panelists and thank you to the professionals that are out there making a difference in the lives of these families as well. And so tried to keep it together, but I couldn't. But thank you all for joining us. And we will be thinking about ways to continue the conversation, because I did see a lot of stuff in the chat. I know some folks were sad that we didn't have the chat open for everybody to interact with each other, but we had over 700 folks register, and that could really kind of make things chaotic for the host and panelists. And so we decided to limit it, but there clearly is a need where folks want to connect with others. And so we'll think about that, have some thoughtful ideas on how we can get families connected to one another. So thank you. Thank you, everybody who joined us today. And that will be the end. Unless, Christy, if you have anything else, we'll go ahead and end this now.
Nope, that was perfect. Thank you so much, Amy. And thank you again to all of our panelists and everybody that took the time to attend today.
Thank you, everyone.
Thank you.